This is Kathryn Goetzke, host of the Hope Matrix podcast. We are here to share science, stories, and strategies for how to hope. I'm the Chief Hope Officer of the Shine Hope Company, and Shine is the mnemonic for how we teach hope. So when we talk about hope, we talk about how we use stress skills, happiness habits, inspired actions, nourishing networks, and eliminating challenges, which are our thinking patterns that get in the way of our ability to hope. Hope is a skill. You can measure hope, you can teach hope, and you can start practicing skills to activate higher hope in your life today. And on this Hope Matrix podcast, we aim to bring in guests, experts in science, people with stories, and those that have strategies for activating hope in your life. Hello, everyone out there. This is Kathryn Goetzke with the Hope Matrix podcast, sharing science, stories, and strategies for hope and how to shine hope. We are here today with one of the best researchers that I was introduced to when I actually started this work on hope. So many years ago, Matt Gallagher. He is an incredible hope scientist and, has published some new research and a lot of new research that we'll get into, but excited to have Matt here today. So welcome, Matt. Thanks for joining us.
Thank you for having me. It's nice to chat again.
Yeah, I know it's been a while. I don't remember how. I think it was 10 years ago that I started running into your work. That's about.
Yeah, it's been a bit. We've been going back and forth talking about it, and yeah, all the great work that you've been doing of sharing hope and spreading it. It's great.
Yeah, thank you. Thanks so much. Well, I couldn't do it without the science, so I do appreciate that and all that you're doing. So let's dive right in. For those listening that aren't aware, there are actually hope scales. So you can measure how hopeful you are. That's been my mission, has been showing that you could actually teach hope, so you can improve hope in different populations, and that it's a skill that we've got to learn how to cultivate. So, but Matt, how did you get started? So you've been studying this how long?
I've been studying it for nearly 20 years. And so I went to graduate school at the University of Kansas to work with Rick Snyder, who really kind of helped to establish the psychology of hope, make it a more rigorous science. And so he'd been doing work on it for a while, and I was fortunate enough to have the opportunity to work with him. And it's continued to be a major focus of my research for decades now.
Wow, that's amazing. And yeah, so for those listening, C.R. Snyder, that's the adult hope scale we use and the children's hope scale we use. So that's we're in, hope royalty right now with Matt here visiting us. That's pretty amazing. Are you aware, that going back, are you aware of the Today Show appearance that he did?
Mm-hmm.
You are. Can
Yep.
you? I actually want the Today Show to do this again. I think it would be awesome. A great way to elevate hope science. But can you tell us more about what happened in that?
Yeah, so one of the interesting things that Rick had studied was looking at hope and its benefits across many contexts and looking at it as a potential predictor of pain tolerance. And so one way we study that within psychology is the cold presser task, where you get a bucket of water with a whole lot of ice and you put your hand in there. And pretty quickly it's uncomfortable, and then pretty quickly after that it becomes painful. And so part of the idea is that it's not that hope makes you, magically not have pain, but that we find in many contexts, hope makes people more resilient and better able to cope with discomfort, pain, anxiety, whatever it may be. And when he was invited to talk about the science of hope on the Today Show, he was bold enough to do a live experiment to actually demonstrate the benefits of this. So we had, I think, 3 folks that are attached to the show. I believe it was a weatherman, maybe 2 other people, complete the hope measure and then do the cold presser task and see who lasts longer. I think 1 or 2 people quickly dropped out, pulled their hand out of it, and then the last person that was able to kind of keep it going for a while, that person ended up being, when we look back at the measures, the individual who was highest in hope. And so it's something that was a nice live demonstration of the science of hope, that it's something that promotes resilience across many contexts, including kind of pain tolerance. There's a lot of interesting data that's continued to be replicated over recent years.
Oh my gosh, that is amazing. I love that. And I love that work. And especially now we're doing a lot of cold plunges, and
Hmm.
that's then, kind of a new modality. And we were promoting that as one of our stress skills. And I used to say I hated cold showers and I was unable to tolerate cold showers, but I could do a cold plunge. And then I thought, what if I just used my hope skills that I teach everyone to that? And so I changed my belief around cold showers. Actually, I love
Yep,
cold showers. They're so healthy for me. They're good for me. And if I practice my stress skill, when I turn that water to super cold and just start breathing through that, and knowing that it's all right, I can handle this. I love this. This is going to be good for me in the long. I can stay
exactly.
forever.
And that's so much of how we cope with things is how we think about it. And do we have that belief in our own agency, our belief to find new strategies, to persevere in the face of obstacles? It's not denying that we're going to face stressors, but oftentimes it's people need to be reminded to believe in their potential to cope with it because people are much more resilient than they often give themselves credit for.
Yeah, that's amazing. And it's so true. And I loved that real life like example and application of
Mhm.
it. So we'll have to try to get the Today Show to reenact that. I love
Yes.
it.
See if they want to bring that back 20 or 30 years later.
I know. Yes. Yeah, I love it. I'd also love to do that with like sports teams to measure hope scores among the athletes, see what
Hmm.
teams are higher in hope and be able to predict who will win based on that.
Yeah, there's been a little work in athletics looking at, I believe, soccer players, some track and field, kind of looking at hope and its benefits in those contexts. With again, it's not it explains everything, but it's an important factor in terms of helping people to persevere. And that's a lot of athletics. Like you lose, you have to keep going, get better, and then you can win. And so I think hope is an important source of that determination, oftentimes.
Yeah, absolutely. So what are you working on now? What university are you at right now?
So I'm in the University of Houston. Moved back home to Houston a number of years ago. So happy to be back here. And then we're able to look at a lot of things that historically haven't been focused on so much in positive psychology, is looking at how hope and some other constructs perform across more diverse populations. And so that was one of the limitations of a lot of the early work on hope. It was done in Lawrence, Kansas, which is a fantastic town. I enjoyed my time there very much, but it's not the most diverse in a number of ways. And so it was kind of looking at, we know hope is beneficial for certain populations. A lot of what I've been doing and my team has been doing here in recent years is, what if we extend that and look at, well, in the aftermath of natural disasters or looking at kind of more diverse populations, is hope as beneficial for different populations, for people of different backgrounds, people who face different kinds of burdens like discrimination and so forth. And so that's been a big focus of what we've been doing, is trying to make sure we understand hope across cultural boundaries, across the lifespan, different kind of populations.
Yeah, amazing. And so what are some recent studies that you've been doing? I mean, I know I reached out again because of a specific paper that I love that I know share more on, but
Mhm.
yeah, just in general, what are you?
Yeah, so one study with my graduate student, Elijah Murphy, was looking at hope in the context of discrimination. And so trying to understand discrimination, something that is not surprisingly very toxic for individuals' mental health. And people have to face it for whether it's race, gender, age, there's lots of reasons that might be the source of that. But we know it has a really harmful effect on mental health. And so what we wanted to do is to look at, what are the benefits of hope in that context, that when we control for that, not that hope is going to make it so that discrimination isn't painful, but that if we accept the reality that unfortunately people do face discrimination and we need to do better on that, but we need people to have tools to cope with that right now until we can do better kind of as a society managing that. We wanted to look at the role of hope and how it protected mental health, promoted well-being, when we looked at it in a large sample of Black, Latino, and Asian adults. And so we did that in a study that was recently accepted for publication, looking at that in nearly 3,000 individuals to quantify, when we account for this toxic impact of discrimination, is hope still protective? Is it still powerful? Is it still helpful? And so looking at that in terms of showing that hope was associated with lower levels of depression and anxiety, even when accounting for discrimination. And also, I think one thing that's important that's often understudied in psychology is not just looking at mental health in terms of bad outcomes, but looking at the presence of well-being. So meaning in life, life satisfaction, positive emotions. How does hope predict those positive aspects of mental health that we all want in our lives, but are studied a lot less in psychology? And so we looked at the role of hope in predicting those factors as well. And the great thing was we found, not surprisingly, discrimination was associated with more anxiety, depression, less well-being, but hope still had powerful effects on those outcomes in the expected direction. So more hope, less anxiety and depression, more hope, more well-being, and that was across the different groups. And this was in a sample that ranged from young adults to middle 50s, and so pretty good distribution in that way, finding that hope, even in the presence of discrimination in that context, when we control for that using some fancy statistical methods, those effects still came out very nicely. So that's a study that we were happy with that Elijah Murphy, graduate student, kind of took the lead on spearheading recently.
That is amazing. And I think it's so important. I mean, and that's, my aim is to get all youth and especially inner city youth equipped with these skills of what it
Mhm.
takes to build hope and understanding that we got to learn how to hope. We have to practice skills. We've got to, LGBTQ community. I mean, females are higher in hopelessness, but it's like learning these skills, practicing these skills so that we're better equipped to deal with the many ways that we get oppressed in life or discriminated against, which, when we look at our locus of control, how much control do we have of these other people and what they're doing? And, for my own personal experience, the more I focused on that, the more hopeless I became. Whereas if I started focusing on what I could control around it, and one of those things is my ability to navigate things in healthier ways. So it
Yeah, and
doesn't
that's
make,
we can't always control the circumstances around us, whether it's discrimination or natural disasters or car accidents. A lot of people go through various types of trauma, and unfortunately, we can't control that, but we can control oftentimes like how we try and respond and cope with that. And so
yeah,
that's another thing we've done of looking at when people are struggling, when they have some sort of anxiety disorder, what's the role of hope in terms of promoting recovery? And that was another study we published a few years ago showing that hope can meaningfully change during psychotherapy. And so some of the best treatments we have can have clear, robust impacts on hope. And that the more hope changes in therapy, the more anxiety reduces. And so finding that across a number of treatments, a number of clinical presentations, it's not just that some people won the hope lottery and they get to kind of enjoy the benefits. These are skills, as you said, that we can meaningfully target, change, and improve so that when we have people that are struggling for various reasons, we can kind of lift them up, and hope is one strategy that can be powerful in doing so.
yeah, that's amazing. And it's, I talked too about hope isn't just about being happy. It's about
Mm.
acknowledging our pain. I mean, it's not, I think the ice thing is a perfect example. It's like, he's not there going, oh, this, like, I don't feel any pain. Or he's like, I have capacity to tolerate this. I can get through. I know what's in the future. I know what's on the other side and the ability to get there.
That's exactly right. And that's, I think, one of the biggest misconceptions about hope is the idea that it's a passive thing where you avoid negative experiences to just try and feel happy. When what we know about people who are higher in hope in the ways that we study it is that they're more willing to approach situations that might involve some discomfort, might involve some uncertainty, because they're willing to tolerate some of those feelings that can be uncomfortable, but they know in pushing through that and persevering to pursue their goals, that's how they can achieve what is it they want to. And so it's not all about just trying to avoid any feelings of discomfort. It's not that you're kind of seeking out misery, but some things are challenging and involve stress, and we have to kind of push through that and do that while not doubting ourselves. And that's what we know about hope, is that people are better able to persevere in the face of obstacles.
Yeah, yeah. And that was, I mean, in my young days, that was my biggest challenge. I couldn't sit in any distress. I didn't like the distress. And
Mhm.
that's why I turned to all of these other things that helped me feel better in the moment, but weren't healthy for me long term. And I think that's, why if you're higher in hopelessness, probably turn
Yeah.
to things like addiction.
And it's really tough because those things, people can fall into those traps because they are more immediately reinforcing.
Yeah.
So if you're feeling nervous in a social situation and you leave, you get that immediate sense of relief. And so it helps you feel better right away. Whereas staying there, having the conversations, building the skills, building that comfort, that's much better in the long run, but it
Mm,
takes you tolerating that initial discomfort. And so that's why avoidance, it's kind of the hallmark of so many clinical presentations. It's tough because short term, it seems like it works. It just gets people stuck in these patterns where the distress tolerance isn't really there. And when they face challenging circumstances, they want to exit because they don't believe they can cope with it, even though
yeah.
they truly can. They just have that doubt in themselves.
Yeah. Right. And then you have the belief. And once you have the belief that you can't cope with it, you can't tolerate it, that just then reinforces
Mhm.
and it becomes bigger and bigger and bigger.
And you don't give yourself the chance to have kind of the mastery experiences where you think about, well, what's the last time I approached this? If you remember, well, I felt nervous, so I just immediately left, as opposed to like, yeah, I felt a little nervous, but I stuck with it and it went great. And so I doubted myself, but I didn't give up, and it works out. And so we all benefit from encouragement, but also having those kinds of positive experiences where we can look back on, I know this is tough, but I know I've been through this before and can stick with it.
Yeah. And that's kind of that hallmark of learning how to cultivate hope is looking at past experiences and how
Mhm.
we've managed those and like applying it to our current challenge or situation and building that more kind of self-efficacy.
Absolutely.
So let's look at it as it relates, because I love this. I mean, there's so much right now about the loneliness epidemic. And
Mhm.
so, and I think that's one of, and with youth or with people in general, like especially during COVID, you get used to being at home and not going out, not looking at people in the eye, not connecting so much with people. And it's just, so then we develop this fear or this, discomfort. And I think, we take for granted that we just can easily connect with people and go anywhere and just connect, but it is uncomfortable. It can be uncomfortable. And so how do we apply this to that?
I think it's important to recognize the challenges and that recent years there's some unprecedented circumstances where people needed to often stay home because it was dangerous with COVID and so forth to go out in certain timing. And so when there's a fear about certain behaviors, that might make sense for a given time, and then it might no longer be relevant. And so we have to kind of break ourselves out of those patterns and remember it's an important goal to have that social contact. And so we need, and people vary in how much they need, but we're social creatures. We need some social interconnectedness. And whether that's friends, romantic partners, whatever it may be, remembering that that's a priority and you have to focus on that goal sometimes and kind of take the steps to make that happen. And it might require you kind of pushing yourself out of your comfort zone. But if that's something you need to do, it's make it a priority that that's the behavior you want to actually focus on. And so, whatever that looks like for a given individual, making sure that it's not just that, yeah, it's lovely to stay at home and just hang out, maybe watch Netflix for a bit. And we also want to make sure we're interacting with other people and maintaining those connections and those social bonds.
Mhm. Have you done any research on hope and social connectedness?
We
Is it
have
that?
looked at hope and one aspect of well-being, of social well-being, and so looking at social cohesion, social integration, kind of the more thinking about meaning in life. But when we take that to the more interpersonal realm, that we know that that's an important aspect of positive mental health. And so we have looked at how hope predicts that component of positive mental health, how it predicts it in relation to optimism, another kind of way that we study positive thinking within psychology. And so we have found that hope is an important predictor of that. And some of our ongoing work is, again, trying to look at this cross culturally and finding that hope is an important predictor of social well being. And that's true for many different populations. And so, one of many factors that plays a role, but it is something that appears to promote that aspect of mental health as well.
Mhm. Yeah, I often think like loneliness, when you really boil it, when you just, which I like to just kind of simplify everything, it's a hopelessness about connecting with others. And once you learn how to hope, so you set a goal for connection, what kind of connections I want to build, and then you create,
Mhm.
steps to get to that. What are the things I have to do to create more connections in my life or a connection or a romantic partnership? what are the challenges, obstacles I'm going to face, and how do I kind of overcome those? If you think about it in that way, if you're taught skills to hope, you should then be able to make connections, because your
Yeah.
hope, that applies to any kind of goal in life. And to me, it's, we've got to be intentional about our connections. Connections don't just like happen.
No, I think early on in childhood, like you're in school, like you have your social connections, it's like baked into your day. But later on, it requires more intentionality, as you said. And it's something that people move to different cities for different jobs, different things come up. And you have to make that intentional effort to foster those connections and thinking about it, as you said, in terms of pathways. You're going to try new things and recognize like some might not work as well. And that's okay. Then you've learned new information about kind of in this context, this is what I'm looking for, this is more successful than this other strategy, but you're taking that as useful information you're learning, not, well, this means I'm a failure, people don't want to be around me. You don't want to fall into those traps that aren't helpful at all.
Yeah, absolutely. Does hope change over a lifespan? Have you done longitudinal
We
on?
have done some work looking at stability of hope across different lengths of time and across kind of different age groups, and finding that hope is pretty stable for the most part in terms of it's something that we can meaningfully change. But if people aren't making an effort to do so, it's pretty static for the most part. And so when people are able to foster and develop that hope, they're more likely going to maintain that for a period of time, which is great. But we do know that people might lose some of their levels of hope in the aftermath of trauma, kind of losing a family member, whatever it may be. When people are struggling with anxiety and depression, it's tougher to maintain that sense of hope in those contexts. And so that's where sometimes people need intervention. Cognitive behavioral therapies are very effective for those disorders. And we've also shown that study I mentioned earlier that those CBT treatments can also be very effective in reestablishing individuals' levels of hope. That when we test changes from the first session to 4, 8, 12 to the final session of therapy, we can see clear and meaningful changes in hope. And so that's a nice thing that we know it can be targeted, it can be promoted. And when we do that, it's not that, okay, you have hope for a week, is that you now have this skill that's been cultivated that you can continue to use even as you leave therapy.
Yeah, that's awesome. And it makes sense when you look at hopelessness being just despair, you feel bad and helpless to do anything about it. And that, of
Mhm.
course, those moments are going to go up when you go through any kind of significant change in your life, and
Yeah.
especially when someone passes away or a natural disaster, that despair and helplessness. And I was just speaking with someone that's in Israel in the middle of a war and teaching kids
Mhm.
skills to hope. But you think about how much despair and helplessness there is there. And I tell them that's when you need to be extra diligent about doing all of your skills around hope, all of the things that help foster and build that hope.
Yeah, in those traumatic circumstances, it's not easy by any means, and
Mm-hmm.
it's totally understandable and appropriate for people to be struggling when they're facing that level of stress. And so it's not about judgment, it's just that people are going to face those circumstances and still need to function sometimes. So like how do we try and support people as best we can? And one thing is some parts of it in terms of like hope, kind of what you can personally do to pursue your goals. Some of it is the social aspect we talk about, making sure you're having that network for social support and also just providing guidance and help in various ways. And so trying to figure out what's best going to help you in the pursuit of your goals.
Mm-hmm. One of the things that's brought up, so when I worked on so I have my hope matrix, like an actual matrix that I developed. And when I teach hope, Snyder's work is a lot around and how do you get out of helplessness to inspired actions? It's a lot about the goal stuff. And I've incorporated on my other side of the matrix is more of my mental health work, which is managing our emotional despair in better ways and getting back to positive feelings and feeling better. Do you have any like just thoughts on that or in your experience or in your work, bringing that emotional aspect into hope science?
Yeah, and so I'm trained as a clinical psychologist. And so a lot of the work that I do is looking at the role of hope in the context of post-traumatic stress disorder, anxiety disorders, depression. And so working with populations in terms of people where there's a lot of emotional distress that we're trying to promote recovery from, that's kind of one piece of my research. And then the other side is people that are doing pretty well, how does hope help to maintain that resilience to help to keep them feeling happy, have meaning, and not fall into the anxiety as much as possible. Like everyone has tough times. And so, yeah, we've done a lot of work looking at the role of hope in the context of different sorts of emotional disorder presentations and how it might look very different if it's PTSD after serving 2 tours in Iraq, or obsessive compulsive disorder where there's lots of fears of contamination, or panic disorder where it's the somatic sensations of you feel your heart racing, you think you're having a heart attack, and that makes it so it's difficult to leave the house with agoraphobia. And that there's a lot of different clinical presentations that are some of the most common forms of mental illness that can be devastating for kind of functioning and well-being. And we've looked at hope in a lot of those contexts in those clinical presentations. And we found, for example, one study looking at hope in relation to PTSD, kind of post-trauma symptoms, whether we looked at those at the same time or looked at how hope predicted PTSD 1 or 2 years later. We recently did a literature review summarizing kind of all the work that's been done in that area and found that there is a clear, robust relationship that hope is not just associated with lower symptoms of PTSD in the moments, but when you look prospectively, hope seems to be protective in terms of predicting lower levels 6 months, 1 year, 2 years down the line. And so, yeah, we have looked at the role of hope in the context of many different clinical presentations and found that it seems to be one important protective factor because it helps us to change the way that we think about and appraise challenging situations. And so that's kind of one of the core tenets of cognitive behavioral therapies is how you think about a situation influences how you experience that situation. And you can't always change those external factors, but you can challenge the thoughts that I'm having of, are you doubting yourself that you think it's guaranteed that the negative outcome is going to happen? Or maybe there's a chance, but it's not 100%. And so those thoughts in terms of how we try and change how people make those appraisals in cognitive behavioral therapies is very congruent with how we think about how hope promotes more adaptive thinking. And so that's why we found that it integrates very nicely and seems to be kind of a common factor in terms of promoting recovery, that capacity to change one's perceptions of pathways and agency in terms of how they cope with different emotional experiences.
Got it. Super interesting. So are there other studies that you've done recently that were ahas or just interesting or different or than you expected?
Yeah, I think a couple of things, again, more stuff looking at in the context of different populations. We looked at how hope related to gratitude in terms of predicting symptoms of distress and well-being in a large sample of people identified as Hispanic Latino who had experienced one or more traumatic events. And so trying to understand how gratitude is another important resilience trait that's kind of more about positive thoughts about the present or the past, whereas hope is about kind of the present and the future. And so we thought that those might be complementary in terms of it's not that one is good or one's bad or one's going to win, but that these are both important things we need to have in terms of having that appreciation of the past and also the hopefulness for the future. And so Amy Singer, another one of my graduate students, took the lead on a project that was recently published looking at what are the complementary roles of hope and gratitude when we look at trauma exposed Hispanic Latino adults, to look at are they still protective in that context, and finding that gratitude and hope both were playing a meaningful role in terms of promoting higher levels of well-being and lower levels of the distress outcomes. And so continuing to find that the levels might vary a little bit, but when we look across different populations, and even when we test hope when controlling for other constructs, we continue to find that hope really is robust in terms of its ability to uniquely and meaningfully predict positive mental health outcomes.
Wow. Have you done anything in the workplace?
I have not done much in the context of work. No, I don't think I've done much of that. I think in kind of the handbook I edited, we had some stuff on, hope and work, but that's never been my focus. I'm not an IO psychologist. So I think that's something that's definitely important. There's been work done in that area in terms of employee satisfaction, job performance, some of those kinds of things. So it's definitely an area where hope is relevant, and it's something where talking about the social dynamics, we know that it's easier to be hopeful around other people that are hopeful. And so the extent to which to organizations or communities can provide a supportive foundation for people experiencing hope rather than kind of despair in the workplace, that's something that not only leads to improved like employee satisfaction, but also improved productivity. And so it's not just like, oh, people feel better, it's like people perform better. And so we know that's the case. And so it's something that it's a good outcome for the bottom line as well as people feeling better.
Mm-hmm. Yeah, that's awesome. There was a cool study done that hope predicted your future level of anxiety and depression, but that your anxiety and depression didn't predict your future levels of hope, which to me was exciting because it was probably at a time when I was depressed and I was like, I can get better at hope, I can improve at this, and then I can protect myself from anxiety and depression in the future. Is that pretty much what that study?
Yeah, and I think that's what we found in terms of when we use kind of fancy modeling techniques to what has more robust effects over time when we're controlling for different factors. That's some of the work that Randy Arno did a study on that. I've done some studies on that. Various people have looked at that. When we look prospectively, hope does hold up. And so it's not just that people are doing better, have hope, and they keep doing better. Like hope does have that positive kind of spiraling effect. But even in the context of if there is some anxiety and depression, when you look prospectively, when you look longitudinally, hope seems to have larger and more robust effects on outcomes, even when you control for them at earlier time points than vice versa. And so that's nice in terms of showing the robustness of the effects of hope. It's not just a artifact or kind of secondary to something else. It is really a driving force.
Yeah, that's amazing. And I found that to be true. I mean, I've, in the last 10 years, it's because I'm so diligent about all of the skills I do and what I know it takes to practice hope. It's, I've been in recovery almost 20 years, so quite a while. And so, and it was my addictive, that I wanted to escape. I had no emotional tie. I didn't like feeling negative emotions. I couldn't, stand the pain. And the last 10 years, it's like learning how to deal with the pain and getting through it and getting to the other side. I talk about it like surfing, we just learn how to surf, and it's much easier. And I've been so healthy the last 10 years, not that I don't feel really deeply. It's that I just know how to deal with it. I know how to,
you have that belief that you can, when you face stressors, like we all do, things happen, your car breaks down, you get in an argument, whatever it may be, that there's distress, there's discomfort that comes with that, but you believe in your ability, your capacity to kind of ride that emotional wave. And so you don't fall into the avoidance, which just makes things worse. Like people do it because it feels good in the moment. And whether it's, you leave a situation or you feel distressed, so you start drinking or smoking, it's understandable why people fall into those because they seem like they work, but they don't work long term. And so that's something that hope is nice, that it doesn't require expensive technology. It doesn't require anything complicated. It's not easy to kind of always maintain that focus on how we are thinking about situations, but it's something that's within our control and that we can help train anyone to try and cultivate that skill. And that's part of why it seems to be so powerful.
Yeah. That's amazing. So are you high in hope?
I think so. Been studying it for 20 something years, so it's got to be something with that there.
Yeah. That's amazing. Yeah, any other studies or things you've been learning recently about hope since we last connected?
I think one thing that we've got ongoing now, talking about substance abuse, is kind of looking at some of those intersections of different clinical presentations. And this is more of an ongoing study, but when we test people who are struggling with anxiety and depression and turning to nicotine or smoking as a way of coping, that's one of our ongoing studies, is looking at interventions for that. And again, what's the role of hope in that context in terms of, if we cultivate hope, can that help people to diminish their use of smoking as their kind of coping technique and then feel better? And so we don't have the results of that yet. That's a study that's been ongoing for a number of years, but that's some of our work, is trying to continue to expand our understanding of, does hope work for people of all backgrounds? Does it work in the same way? How do we understand that? So we make sure that positive psychology is a supportive resource for everyone.
Yeah, it's amazing. And I mean, I'm super passionate about coming at it from violence too. I think,
Mhm.
higher in hope. And the first thing we teach our kids is really about the stress response and using stress skills to understand and manage our stress response in healthy ways as opposed to unhealthy ways. And
Yep.
violence, addiction, like you said, smoking, they all feel good in the moment. They release endorphins or dopamine and feel, but it's not healthy for us. And so what are other ways to get those positive hormones,
Mhm.
or help?
Yeah, they seem more uncomfortable acutely, but they're more protective and more health promoting long term. And so sometimes it's helping people to recognize that it's never about shaming people, but helping people to recognize the patterns that we fall into. People are busy, people are stressed, they might not be realizing how that's impacting what they're doing. And so helping people to reset, to reevaluate, to think through for your goals, whatever they may be, kind of are these the most effective pathways to achieve them? And that's sometimes what people do need is just that support and that guidance in terms of let's take a step back and thinking about how are you approaching, how are you appraising the situation, and what are alternatives? And that itself can be powerful. Sometimes people just are falling into this is the only way I can think about it. And so just, well, what's another way of thinking about that? That question itself can help to kind of break that rigidity in terms of it's guaranteed to go badly or whatever negative thoughts you might be having.
Yeah, I love it. You ever think we're going to have a day when hope mandated in school systems and
I think it would be great. I mean, hope, emotion regulation, there's a lot of things that psychology is doing to help us better understand like what promotes resilience and well-being. And these are things that we all need, that we all face stress. We're all managing relationships. We're all trying to kind of achieve our goals in life. It would be lovely if part of early education was more focused on emotion regulation and coping, and hope's one valuable skill. There's many others. Um, but yeah, I think that would be a lovely addition to kind of standard curriculum. That it's an important piece of development and education is how do you manage your emotions and how do you regulate them?
Mm-hmm. That's awesome. Well, any other final thoughts or words of wisdom for our listeners? I so appreciate this update on all the work you're doing.
Yeah,
On
I'm happy
all.
to chat with you and share some of the work that we've been doing. And I think just the common message that we're finding across all of our studies, and there's others across the states and really around the world that are studying the science of hope these days. And we are finding that it is something that is powerful across many contexts. We just kind of recently edited a special issue summarizing more than a dozen kind of different areas of hope science, showing the ways in which it continues to be a vibrant area of research, and that it is something that is protective and it is something that can be cultivated. And so it's not just a passive, you're hopeful or you're not. It's something that anyone can, with focus, with effort, can cultivate hope in their own lives. And that is protective. It's not going to make everything easy for you necessarily, but it'll help you kind of bounce back and cope with stressors in your life more effectively. And so I think remembering that it's not just a luxury, it's very powerful, but it's something that all of us can target in our lives, which is nice.
I love that. And Dr. Gallagher, doctor, I should call you doctor. How can people learn more about your work?
So my website, the University of Houston, has some resources about some of our recent ongoing studies, and I think um, myself, other kind of researchers in the area, Kevin Rand, Jen Chevins, there's a lot of people doing hope science. We're happy to kind of share our resources and some of the work that we're doing, and I think there's a lot of active work in this field, and so it's a vibrant area of research. It was started many years ago by Rick Snyder, as I said, in Lawrence, Kansas, but it's now spread around the world, the science of hope, and it continues to show that it's a powerful and influential source of resilience. So it's great.
Yeah, absolutely wonderful. And the sunflower is the international symbol of hope. So we love that it started in
Mm-hmm.
Kansas,
Yep.
the
Yep. It
home
is
of the
very
sunflower.
fortuitous in that way.
Yes, amazing. Well, thank you so much for joining and giving us an update and sharing the latest science on hope. It's so important that we, educate and inform others on why hope is so important and
Mm-hmm.
needs to be taken seriously and practiced and cultivated and
Yeah,
all
absolutely.
of.
And thanks for everything you're doing to help to spread the science of hope. It's really important to get it outside of just the universities, but make sure people in different communities and settings are learning about the benefits of hope. So thanks for all you're doing as well.
Yeah, thank you. And thank you to all you listeners for joining in. Please share this episode with others and teach others about the science of hope. And if they're struggling, there are skills that we can practice, and there is help out there. So please reach out for support, and we'll put the link to Matt in our in the paragraph description about this podcast episode, so you can look him up and follow his work too as well. So thank you all for joining. Have a wonderful day and keep shining hope. So thank you all for listening in to the Hope Matrix podcast. We want to shine a light that hope is teachable, hope is measurable and teachable, and provide you with actionable insights for how you can start activating hope in your life today, and provide a framework so you can start talking about hope with other people and practice these skills together, because we are better with hope. Please feel free to check out theshinehopecompany.com, where we list all of our resources around how to hope. We have a lot of free programs for how to hope, including the 5-day challenge, our hope infographic with a lot of skills that showcase how to hope, and articles of how to incorporate hope into your life. We have the Hope Beat Weekly, which is a weekly newsletter that shares strategies for hope. We have a My Hope Story template, so you can write your own hope story today. Also, My Hope Hero, so we can share what our heroes are doing to activate hope in their lives. And this is especially good with youth, so they can start looking up to people that have overcome similar challenges to them and seeing how these heroes use the Shine Hope framework. We have a Hopeful Minds for Teens program, a Hopeful Minds overview, educator guides. We have a new evidence-based college course, so you can activate hope on the college campus. There are programs in the workplace, overview courses, 90-minute courses for learning the what, why, and how to hope. What I want you to know about hope is it's a skill. You've got to practice these skills to become hopeful. It's easy to fall into despair and helplessness when we deal with challenges in life, and it takes intentional work and practice to get to hope. And yet it is always possible. So no matter what life brings, keep shining hope. Thanks so much for listening in. Have an awesome day. And of course, I've got to add that this program is designed to assist you in learning about hope. It should not be used for medical advice, counseling, or other health-related services. I, Fred, the Shine Hope Company, and myself, Kathryn Goetzke, do not endorse or provide any medical advice, diagnosis, or treatment. I am not a medical doctor. The information provided here should not be used for the diagnosis or treatment of any medical condition, and cannot be substituted for the advice of physicians, licensed professionals, or therapists who are familiar with your specific situation. Consult a licensed medical profession or call 911 if you are in need of immediate assistance. And be sure to know the crisis hotline, 988, if you are in need of support. Thanks a bunch for listening. Take good care of yourself and keep shining hope.